Assalamu alaikum. The long clinical consultation day. The first scenario, Mrs. Smith. She is 30 years old. She had amenorrhea. Please take history and examine her, address her concerns. Yes, you can start now. Here you go.
Hello, I'm Dr. Naji, one of the doctor here. Are you Mrs. Smith, 30 years old?
Yes, doctor.
We are here today to discuss some issue about your health condition, and I want to examine you. It's okay with you?
Sure, doctor.
Okay, Mrs. Smith, you can tell me why you came today?
Yes, doctor, I have been complaining from no period since 6 months. Since 6 months, it is no period. So I came today to know what is the cause.
Okay, I'm sorry for that, Mrs. Smith. Okay, Mrs. Smith, this is first time?
Yes, doctor. Yes, I think it is the first time.
Okay, there is any chance you are pregnant?
I don't know, doctor.
Okay, Mrs. Smith, you can tell me what's about your period? When
Yes,
is
no,
that? First period, which age, Mrs. Smith?
I think, doctor, it started since I am 14.
Okay, it's regular.
Yes, doctor. It is regular. It was regular.
Okay, what's about the amount?
Normal, doctor.
Okay, last period before 6 months, it was okay?
Yes, doctor.
Okay, Mrs. Smith, can I ask you, what's about, are you married?
No, doctor. I have partner.
Okay, you have any children?
No, doctor.
Okay, for how much you are married?
No, I have partner, doctor.
Okay.
I am not married.
Okay, I understand. Okay. There is any discharge from the nipple?
No.
Okay. There is any headache?
Headache, no.
Okay. There is any change in your voice?
Voice, no, doctor. It is normal.
Okay, or shape of your body?
No, doctor.
Okay. There is any abnormal hair in your face or in the chest?
No, doctor, I don't think so.
Okay. Any skin rash like acne in the face?
No.
Okay. I want to ask you also,
Mhm.
okay, you told me there is no headache. There is any blurring of vision?
No, doctor.
Okay, loss of conscious?
No, never.
Okay, abnormal sensation in any part of the body
No,
or weakness?
no, doctor, but I feel all my body ache.
You have body ache?
Yes, all my body ache, doctor.
Okay, especially where, in the muscle or in the joint?
No, I think it is the muscle, doctor. All my body aches.
Okay, what's about your weight? Increase, decrease?
Yes, doctor, I think I lose weight. I lose weight. Yes, I think that.
How many kg?
I think 6 kilos. 6 kilos.
Yes.
Mhm.
Over how much?
Over 1 year.
Over 1 year, you lose 6 kg.
Yes,
There is
doctor.
any increase in the temperature?
No,
Any lump or bump in your body?
no.
Okay. You tolerated for hot or cold weather? Intolerated for hot or cold weather?
I don't know, doctor. I think no.
Okay. There is any chest pain?
No,
Okay. Any racing heartbeat?
no,
Okay. Any cough?
no,
Tummy pain?
no, doctor.
Mouth sore?
No, I don't think so, doctor.
Difficulty in the swallowing?
No,
Okay. Any acid brush?
no.
Any feel sick
Feeling sick? No,
or throwing up?
no, doctor.
Okay. Okay. There is any tummy pain?
Tummy pain? No,
Change in the size of the tummy?
no.
Okay. There is any change in the bowel habit?
Sometimes, doctor, I have constipation. Yes.
You have constipation since how much?
Sometimes along 1 year, Sometimes I have constipation, not all the time. Mhm.
Okay, but there is no tummy pain.
No, doctor, never.
What's about water work?
It is normal, doctor, yes.
Okay, no change in the amount,
The amount, no,
not increase degrees.
no,
Okay, there is any leg swelling?
no, doctor,
You have any past medical history I must know about it?
no, doctor.
Or surgical history?
Surgical, no.
Okay, you use any birth control tablet or something?
Yes, doctor.
Yes, since how much?
Since 5 years.
Okay, you have any pregnancy before?
No, doctor.
Okay, any loss of pregnancy?
No, I didn't
Oh.
pregnant. I don't be pregnant.
Okay, okay,
Mm.
okay. What's your work for living, Miss Smith?
Yes, doctor, I'm a student.
You are a student.
Yes,
Okay. How much this affect your life?
yes, doctor, affect me a lot. I have tiredness and I have bone ache all over all the time. So it affect me a lot.
I'm sorry for that. I will try to help you, Miss Smith. Okay, you smoking?
No, doctor.
Okay, drink alcohol?
Sometimes, doctor, yes.
Okay, last question. There is any skin rash?
Skin rash, no.
Okay, you told me there is no joint pain. I'm
No
right?
joint. No, doctor, no joint pain specifically, but all my body ache.
Okay, there is a specific time for the body ache or all the time?
No, doctor, not specific time.
Any family history, same like you or same
No,
condition or another condition in your family?
no, doctor, but my mother have hypertension and increased blood sugar, so no specific.
Okay, can I examine you?
Sure, doctor.
Okay, I will start by the hand. There is any leukonychia, any pulmonary erythemia, any clubbing or pallor,
No, doctor.
or any discoloration in the palm?
No.
Okay, I will go to the pulse. It's regular.
Yes, pulse 55.
55. Okay, what's about blood pressure?
Blood pressure 110 over 70.
110 over 70. Okay.
Yes.
I go to the face. There is any anemia?
Anemia, no.
A pallor or jaundice?
Bale or jaundice, no.
Okay, I go to the mouth. There is any mouth ulcer or any mouth ulcer or any bad hygiene or infection?
Yes. No, doctor.
I go to the neck. There is any, I ask her to drink a sip of water. There is any enlargement?
No, doctor.
Okay, and I go to the back and I will examine the thyroid. There is any enlargement in the thyroid?
Yes, palpate now thyroid.
Yes.
Yes, okay. It is normal.
Okay, no lymph node in the neck.
No.
I go to the abdomen.
Okay.
I will examine the abdomen, superficial and deep. There is any pelvic mass?
No pelvic mass, no organomegaly.
Okay.
Mhm.
Lower limb edema.
No lower limb edema, doctor.
There is any abnormal hair in the face or in the chest?
No.
Hysterism, I mean.
No.
Okay. No acne in the face?
No acne in the face, no.
Okay. What's your concern, Miss Sarah?
Yes, doctor, what I have, is it cancer?
Okay, Miss Sarah, you told me you have you lose of your period since 6 months,
Yes, doctor.
but you are not sure if you are pregnant or no. And you told me you have body ache and
Yes.
with weight loss. I'm right?
Yes. Yes,
Okay. There is sometime constipation. You want to add anything, Miss Smith?
No, doctor. That is all signs I have here. Yes, you are right.
Okay, Mrs. Smith, after I examine you and after I take information, the cancer, one of the possibility. Okay, I need to do some investigation for you. Okay, and after some image and some investigation for you, after that I will discuss the result with you. It's okay with you?
Okay, doctor. So do you will admit me in the hospital?
No admission, but I will do investigation, then I will sit with you again. Okay.
Mhm. Okay, doctor. Thank you very much.
Okay.
It's in 5 minutes. You want to ask more about the history? You want to examine?
Okay, doctor. Sometimes I have these spells.
What?
Sometimes I have these spells.
Sorry, you have what?
Dizzy spells, dizziness.
Dizziness. Okay, when you're sitting and standing, there is dizziness.
Not related, doctor, but sometimes like that.
Okay, but there is no discoloration in the palm or in the mouth.
Yes, no, doctor.
Okay, okay. There is no change color white in your skin
No, doctor.
or a yellowish discoloration of your eye.
No,
Okay, there is no family history, same like this thyroid problem or vitiligo in your family.
no, doctor.
Okay. Okay, I examine also the eye. There is any problem in the acuity of the vision or acuity of the vision, or there any temporal hemianopia or something?
No, doctor.
Okay. Any surgery or head trauma before you did any surgery or head for the brain?
Never, doctor.
Okay, you said you have decreased the weight. This is intention or inattention, Miss Smith?
Yes, doctor, is intended.
Okay, you changed diet or physical activity?
Yes, doctor.
What, you increased your physical activity?
Yes, doctor.
Okay. Since how much you increase your physical activity?
Since long time, doctor. I like to play football, so I play football a lot.
Okay.
Mhm.
Okay. What's about, sorry for this question,
Mhm.
about your intimate relationship? It's okay?
I don't notice, doctor. I don't know.
Sorry, you lose of desire or something? I mean like that?
I don't know really, doctor. But I think no.
Okay. Okay, last question. I want to ask about the shaving. How many time it decrease?
It is normal, doctor, yes.
Okay, normal.
Mhm.
2
Okay.
minutes left.
Okay, any another concern, Mrs. Smith?
Uh, um, no, doctor, thank you very much.
Okay, thank you.
Mhm.
Okay, you want to tell her about another diagnosis now?
Yes, I think she has what's called premature ovary failure. This is my diagnosis.
Mhm.
Still, you have 1 minute and a half. You can explain, you can
Okay.
change the possibility, the concern.
Mrs. Smith, after I examine you and after I take information, I think you have a case called premature ovary failure. That's
Mhm.
that's mean the ovary, the six bag not working well. For that, you not have menses since 6 months. One of the possibility also, I must do for you pregnancy test. I need to do some blood work and investigation image. Then I will discuss with you. It's okay with you?
Thanks, doctor.
Okay, thank you.
Thank you, doctor.
Okay.
Another concern?
No, doctor, thank you very much.
Okay.
Okay, great. Let's go to the examiner. Dr. Mahmoud, please start.
Okay, doctor, present your case and tell me your differential diagnosis.
Okay. This is 30 years old, female. Medically, no past medical history. She came with amenorrhea since 6 months. The first menarche at 14. The period was regular. The patient no another. She has recurrent spell and she has constipation and body ache. By examination, no acne, no hysterism. Yes, she has also weight loss 6 kg over 1 year. And by examination, no acne, no hysterism, no abdominal or pelvic mass. Yes.
Okay, doctor. So, what's your differential diagnosis?
First diagnosis for this patient, I put premature ovary failure, and I ask if there is any family history of the same problem or if she has any sign of the autoimmune disease. Pregnancy, one of the possibility also, and anything cause hyperprolactin, but I'm not find. Yes, polycystic ovary also one of the cause. And cancer, also ovary cancer, can one of the differential diagnosis.
Okay, doctor. So, what will you do to this patient?
I need to do some investigation for her. I need to do first routine investigation like CBC, chemistry, renal function test, liver function test. I need to do for her hormonal screen like luteinizing hormone, follicular stimulating hormone, and I want to do for her also estrogen, testosterone, and I need to do also ultrasound for ovary. And yes, this is the investigation, MRI brain.
Okay,
and
doctor.
CT pelvic, yes.
Okay, so what is this patient to diagnose premature
pregnancy test? Pregnancy test. Yes, what you said, doctor.
Sorry. What is in this patient to diagnose as premature ovarian failure? What
really,
is the positive signs? I mean,
positive sign. Really, I looking for if the patient she has another autoimmune disease,
yes,
like thyroid or liver. I check if she is anemia, pernicious anemia. Really, I'm not find anything also, and but I don't know because I'm not find any another cause in this patient.
So
Maybe
if
physical
you,
activity, heavy physical activity also cause amenorrhea, but I don't. I'm not sure really.
So if you don't find any causes, what is the cause now?
Pregnancy also one of the cause.
Yes, very good. Pregnancy. And what else?
Pregnancy. Also stress, psychological, like heavy
Yes.
exercise for this patient. She changed her physical activity. For that, one of the cause of the also amenorrhea.
Yes, it's one of the causes.
Increased prolactin. Like if the patient. No, I know in the history nothing go with the prolactin. Maybe pregnancy cause hyperprolactin, and also if there is hypothyroidism.
Hypothyroidism secondary.
Yes.
Yes. Okay. And okay. But it is not the case, Dr. Huda. Okay, you did well, Dr. Huda. You started the case very good, really. When was the first period? And you start from the pituitary and the thyroid, and go down with the case.
Dr.
This
Mahmoud,
case, yes,
please,
I finish.
hold a second. Yes, I know. It's still 15 seconds or 10 seconds. I will ask here one question. You mentioned,
Yes.
Dr. Al-Huda, about weight loss. What you get
Yes.
from her weight loss? What do you think about it?
Weight loss, it's can pregnancy, and I can think about Addison disease.
Okay,
But
you ask her,
no another
is it intended or no? What she answered you.
attended. Yes.
Intent. So what it means, but by intentional loss of weight? Why she's losing weight? What do you think? And what
She
the
has
relation?
anorexia nervosa.
Yes, that's thank you.
Yes,
Thank you.
آه،
yes, that
Okay.
is the case.
Okay, Dr. Mahmoud, now you can go.
Thank you.
أكثر منك يا دكتور محمود.
Thank you,
عارفة إنك
Dr.
هتقول إيه.
Bassem. No, it is a common case in the exam. Really, it is a common case. The diet before the last diet. My friend, I think he's here. In his exam, the two consultation was amenorrhea, one Sheehan and one anorexia nervosa. So it is a really important. Yes, Dr. Bassem, two amenorrhea in his consultation.
يس دكتور، المشكلة إنه فكرت بشيرمان، بس هي no pregnancy at all
Yes,
ولا abortion حتى،
yes. So
والشيهان ما عندها أي pregnancy، فأنت
Okay,
أوكي بس
we will comment on that, Dr. Huda.
yes, Dr. Huda,
Yeah.
you did well, really, but you have a big mistake. When I tell you lose weight, I tell you yes, I lose weight. So the next question, it is intended. I will tell you yes, it is intended. So when you tell me okay, what is your appetite? It is two important question after lose weight. I will tell you yes, doctor. I didn't like to eat because I fear from being obese. So I didn't like to eat. That is the first.
أوكي
That is the first to diagnose anorexia. But the most important thing in this case to exclude other causes of amenorrhea. Start from the upper. Yes, we will start from the pituitary. You will ask if there is any cold intolerance because of secondary thyroid. What is your desire? Any loss of desire? Also, you will ask disease bills. In this case of anorexia, there is really was in the exam. It was disease bills. But when you ask the surrogate, okay, how many times you have this bill? I will tell you, yes, doctor, it is one time or two time, but nothing. So it put these bills here to distract you from the case,
أوكي
or to put Addison as second official diagnosis. So you will start from pituitary and then thyroid. You should ask in thyroid hypo and hyper because hyperthyroid will cause amenorrhea. So you should ask any user preference, any constipation, any loose motion. I will tell you no. About yes, adrenal tumors and adrenal failure. You asked me really a very good question. Any abnormal hair distribution? I tell you no. Okay, about premature ovarian failure, yes, it is one of the official diagnoses, but you should ask if you have any hot flush, any mood changes recently, and then the pregnancy also in the official diagnosis. So on examination, you should start yes from the hand, lychonychia, chlonychia, and then the pulse. The pulse may be brady because the patient uh, didn't eat.
bradycardia.
Yes, and the blood pressure
Yes.
you should you will put during history taking you should thinking about the diagnosis because the examiner will tell you what else. So in the blood pressure we will do supine and standing. Okay.
Yes.
So
Yes.
yes, and the mouse about any pigmentation, any dental caries, because maybe also the another anorexia nervosa. It is I think bulimia. The patient put his hand in the mouth to vomit. Okay, and you should
Yes.
yes, and you should examine the heart. I think
Yes.
it is important to examine the heart. Okay, and also see the hand if there is any pigmentation in the hand to exclude the Addison. So with the examiner, you will tell him that the patient has lost weight. It is intended and didn't eat for fear of being obese. I couldn't appreciate any finding about the Addison. So he will tell you what's the diagnosis. First will be anorexia nervosa. Second, maybe Addison. Apart from that, no, I didn't appreciate any pigmentation during examination. And also there is no yes, in examination also blood sugar. You should examine the blood sugar. And the
Yes.
and the third may be pregnancy. Patient may be pregnant. And the fourth will put yes, premature ovarian failure. Apart from that, there is no hot flashes. And also in the history, you should ask about the mood. What is my mood? I will tell you. I will tell you. Life is stressful. I have many stress in my school, like that. Okay, about yes, the examiner will tell you what is the investigation. Yes, you tell that CBC looking for any anemia, and the most important thing it is electrolyte. And the most important thing in electrolyte it is the phosphorus, because the phosphorus may be low.
Yes.
All of that phosphorus, and yes,
Hypokalemia.
yes, and the hypokalemia, Dr. Basim, yes, and also you should in the investigation you should all pituitary hormones, ACTH, TCH, growth hormone, prolactin, cortisol, all pituitary hormone. You should because the patient may have hypopituitarism. Okay, and the concern of the patient, you tell here the most probably this decrease of the period, your amenorrhea may be due to the stress and also the lifestyle that you have. Once you start normal feeding, most probably the condition will be improved. And with the examiners, what is the treatment? It will be refeeding, and patient may need psychiatric referral. That is the case, Dr. Lohada. It is a common case in the exam because this case don't need any patient, just surrogate, send surrogate.
Okay. I'm not thinking about anorexia nervosa لأنه بالعادة بيجوا بنيورولوجي
Yes, neurology. You ask
نيوروباثي وحاجات كده.
Vitamin deficiency, yes.
Yes, إنه أمينوريا خاصة كذا ما أوكي بس very nice, really very nice case.
Thank you, Dr. Hoda.
Really
But
thank you.
it is common. Really, Dr. Khalid, it is Sudani also. He had two cases in the basis consultation was amenorrhea. The two cases was amenorrhea. One
Very
anorexia
common
nervosa.
in Egypt.
Yes, one anorexia nervosa, and the second was Sheehan syndrome.
Yes.
Thank you, Dr. Hoda.
Okay بس دكتور سؤال هو عن
Dr. Huda, try to ask in English, okay?
Okay, sorry. One question about the loss of weight. I must ask after if she said yes. I
Yes.
ask what after that.
It is intended or not. I will tell you intended. I need to lose weight, and you will see the patient is thin. So why this patient lose weight? I will tell you because I like to be thin. I like to be fit, like that. And then ask about how about your appetite. I will tell you that I didn't like eating. I don't want to eat.
Plus
Yes,
psychiatric illness.
Okay.
I think this patient will be depressed. Plus feeling herself to be obese. This is one of the manifestations. She will tell you, doctor, I am very obese. I want to look slim.
Yes.
That's why I'm trying to lose weight. Okay. Bulimia nervosa, she's trying with every meal, she will try to put her her finger in the back of her mouth to induce vomiting.
And there is third one.
Yeah, and you have to examine the back of the tongue.
Yes, Professor.
For ulcers. Because of the acidity, she will have ulcer in her tongue or the base of the tongue. The body mass index is very important to ask about how much your body mass index, or you can ask the examiner, I want to check her body mass index. So the weight will be low, not only underweight, it will be cachectic or even underweight. This for the vitals initially. Okay, let's go to the history. Imagine you didn't know the case as you did. But if you do with the approach step by step, and let's see how you can get the case. Okay, so you start analysis of the complaint, which is good. You analyze the amenorrhea well. Is it the first time? Was it regular before? You can ask also about the amount, any difference, any change, and tell me more about your periods. Then you can ask about, because this is fertility, so you can ask about the children, you have any baby, or you have any kids, and how is your intimacy in the same time. So all this will be as analysis of the complaint plus the relevant system. Okay.
Yes.
The next thing will be the constitutional, as I prefer. So the constitutional symptoms will be about weight. Any change of the weight? Yes, I lost weight. Whenever there is loss of weight or gain or weight gaining, you have to ask how much over how long. In this scenario, she'll tell you I lost 6 kg. Immediately ask her, is it intentional or no? Even if she's not, apart from this case, ask this question usually. Any patient losing weight, is it intentional or no? Why some patient they're using some medication, herbal, to lose weight, and sometimes you will have the case as diarrhea case. Patient is using herbal to induce diarrhea and she's losing weight. So ask this question
Yes.
whenever you have weight loss. If you have weight gain, how to analyze the weight gain? How
Attention or
much? And
inattention.
no, suppose most of the cases will be not intentional, because if she eat intentional, why she will ask your advice or why she will seek medical advice? Okay, but unintentional weight gain, this is the problem. Okay, so let's ask
Okay.
another question for weight gain. What do you think?
Appetite.
Exactly.
Appetite.
So the appetite, yes. How's your appetite? And how the distribution of your weight gain? It's very important. Why?
Yes.
Because because from this question you will get a lot of clues. For example, if she had the weight gain all over her body, what do you think the case will be?
Simple obesity.
Okay.
Uh,
Oh,
acromegaly. No, acromegaly
no,
is
acromegaly will be localized.
yes.
So diffuse weight gain,
The,
yes.
polycystic ovary.
Mm,
Polycystic ovary also.
supposed to be pelvic and abdominal. Okay, what else? But
Yes.
very important.
Hypothyroidism.
Exactly, this is the case. So hypothyroidism will be as diffuse weight gain. Okay, if the localized, so you will ask her what parts of your body you gain weight. So what do you think the importance of every part and what the clue?
Cushing in abdomen and in the back, between the
Perfect.
scapula,
Yes,
and
perfect.
metabolic syndrome also in the abdomen.
The
Most
waist. Increase the
with
waist
yes,
circumference.
yes.
Yes. Okay, and anything else?
Acromegaly in the face,
Exactly.
hand. Yes,
His facial features, the hand size, and the feet size. Okay.
yes.
And what else?
Uh, a local cause.
And the neck, for example. What do you think? Patient getting,
Obstructive sleep.
yeah, it was like sleep apnea. So the
Obstructive sleep
patient will have
apnea.
large neck and large tongue, and also it will be secondary to another disease, either acromegaly or other obesity syndrome. Okay, this is
Okay.
regarding weight gain. Okay, we finished the weight gain. The weight loss, as I mentioned, so you have to ask, is it intentional or no? If intentional, definitely it will be a case of like our case. You will not have any intentional weight loss apart from our case today, anorexia nervosa or diarrhea. For example, patient is taking orlistat, you know the orlistat, laxative,
Yes. For weight.
herbal,
Yes.
yeah, some herbal to lose weight. And the patient will present to you with persistent diarrhea. It came before, yes, it was, but very, I think before, it's not near. So you have to put it in your mind. Patient with diarrhea, with unexplained diarrhea. When you ask her about, are you taking any medication? No, doctor. Are you taking any herbal? Yes, doctor, I'm trying to lose weight. So this is the cause of hair diarrhea. Take care of this case. However, it's not very common nowadays. But I mean, by the way, we are talking about intentional weight loss or intentional taking something to lose weight. So either to be anorexia nervosa, as our case today, or diarrhea related to the herbal she's taking. Okay, the appetite here, as Dr. Mahmoud told you, Doctor, I don't want to eat anything. Okay, why? Because I feel myself obese. I want to lose a lot of weight. And you will look at her, oh my God, she's very slim, even she's underweight, right? So this is the
Yes.
case. Otherwise, if you want to continue your systemic review only to rule out the other causes, but you pick up the case from second approach, which is constitutional symptoms. Let's continue our system review, and you will see how can you rule out the other differential. Okay. So regarding the appetite, we mentioned lumps or bumps or any lumps in front of your neck. What do you think if this patient is having lumps or bumps in her armpit and groin? Is it important?
In this patient, cancer, cancer,
Exactly.
doctor.
Yes, exactly. So you will think about lymphoma or HIV, serious infection with weight loss. And even with this, you might have with under cachexia, you might have amenorrhea because of a low oral intake, right? Okay, back to the system review. We finished now the consultation. Now we will go to the system review. Any headache? What do you think if she has headache? Yes, doctor, I have
Uh,
headache. What do you
Pituitary
think?
adrenal, pituitary
Perfect.
with the
Exactly.
hyperprolactin, yes,
Either hyperprolactinoma or
or ban hypopituitary.
exactly. Yes, panhypopituitarism. So the patient will present with headache or she will have headache as system review. First question in the system review. So you can ask about this headache when exactly started. It might be related to the amenorrhea the same duration. So you will analyze the headache, the scale, the nature, and you have to ask about the vision. After that, if you have patient bumping into the object, now you are talking about adenoma, pituitary adenoma, either panhypopituitarism or prolactinoma, right? Okay,
Yes,
next system, it's still in the CNS, you can ask about carpal tunnel or question for peripheral neuropathy. In this patient might have vitamin deficiency because she's also malnourished, so she might have, or weakness because of also the same low oral intake and low vitamin intake. The patient might present with fatigue or weakness. This is the CNS. The second will be a very important system, endocrine. Now I will
yes,
ask about any intolerance to any weather. What do you think the importance of this question? If she,
hypothyroidism.
yeah. So what could be the hypothyroidism this patient? What type of hypothyroidism?
Secondary, because ban
Exactly.
hypopituitary.
Yes, because of panhypopituitarism, or might have postpartum thyroiditis, and this patient presented as thyroid disease, but the patient will present not with amenorrhea. She will be presented with if hypothyroidism, the patient will present with.
Weight gain,
Yeah, I mean the period
calorie,
itself, the period.
menorrhagia, menorrhagia most.
Exactly. So this is with hypothyroidism, but this is not the case. But we are having now amenorrhea, right? Okay, let's
Yes.
continue our system review. We will try to find out what could be the other possibility. The chest. What do you think the patient is having if she's not eating well? Awareness of heartbeat, palpitation, right? She might have chest
Yes.
pain because of anemia, right? I suppose this case will be anemic. I think so. Anyway, she deny any of these chest or short of breath. Sometimes they have also heart failure because of anemia or anemic heart failure. So she might have short of breath or she cannot sleep or having orthopnea, right? Okay, back to the system review. Any difficult of swallowing or any mouth sores. Even if she denied, you have to examine for bulimia nervosa, right? This is for this third differential. We are trying to pick up the finding or possible differential. The abdomen now, any change of the bowel habit, any tummy pain or tummy discomfort. Here, she has a change of the bowel habit in the form of constipation due to, of course, electrolyte disturbance, right? The urine. What do you think the urine output here? It might be in change.
Little amount.
Yeah, because she's not taking, she's not eating, she's not drinking. She might have oliguria. Then the yes, here it's important to ask about the skin rash and joint pain. What do you think the importance of skin rash, joint pain, muscle pain? And you mentioned in the differential.
Autoimmune
Exactly.
disease or
Any
connective
exactly.
tissue disease.
Yes, in autoimmune association, and it will be associated with premature ovarian failure, right? Now the female history is very important. Are you pregnant by any chance? You can ask here or prior as the initial questions of analysis of the complaint, or you can ask it here. Any birth control pills? Yes, maybe she's on the pills and she's lost the period. And the last question for pregnancy. The pregnancy here is very important part. What do you think the importance of pregnancy in this patient?
Sheehan syndrome or
Exactly.
Sherman syndrome.
Sheehan. Yes, Sheehan syndrome.
Yes.
Okay. Sheehan syndrome. She will have either pregnancy either late or prior before, and after the pregnancy, you have to ask, was it eventful or no? Yes, doctor, it was eventful. I received blood. This is your case now, Sheehan syndrome. So you have the case from the system review, you have the case from constitutional symptoms according to your case. But in our case today, it was about anorexia nervosa, okay? The family history, you can ask, what do you think the importance of family history?
Premature ovary failure.
Yeah, and
Same.
autoimmune, exactly. So the family with autoimmune disease, it runs in family, not in genetic way, but it runs in family. So you have to rule out any family history just to be sure that no autoimmune running in the family, okay? This is regarding the autoimmune and the family history. Travel history, I don't think it's relevant to ask here. Recreational drugs, you didn't ask about recreational drugs. It's very important, right?
Yes.
Then the other HIV risk factor here. You have a partner. Yes, I have. Any casual relationships, just roll out HIV, although it's not relevant here. But HIV as sinister, still you can rule out the HIV, but it's not related directly to the case. Okay. Do you smoke? Do
Okay.
you drink alcohol? What's your job? The impact, and examine the patient. In this scenario, you will examine from the head till the toe because you don't have a clue or a clear diagnosis. Yeah, by the way, the facial appearance, the acne, which is good, very good to ask about, to rule out polycystic ovarian, one of the possible. We missed it in the system review, but you can remember it in the female history. So the female as ovary, you can ask about any change of your facial appearance. The hair growth is very important to rule out because it could be a polycystic. Although the patient with polycystic ovarian, she will have what about the weight? Either
Please,
exactly, she will gain weight, not to lose weight. Okay. The examination again, as I said, according to the case. Here you will have the underweight patient, body mass index low, and you can offer examination of the tongue for ulcers and soreness. You can also ask for the vitals, as Dr. Mahmoud said, posture hypotension, as well as for the facial appearance, the acne, the hair distribution, all these to rule out polycystic ovarian. Then I think nothing here will be added in the history, sorry, in the examination. The nipple, you can offer also examination if there is discharge for prolactinoma. However, no headache. So we rolled out the prolactinoma. The investigation, I think it was mentioned, all you have to screen all hormones from pituitary, ACTH, LH, FSH, and TSH, all the hormones you have to examine or to investigate. MRI, of course, you have to do if you suspect, but don't offer it here. Okay? They will say this is unnecessary because it's, I think, clinical diagnosis. No need from the electrolytes, from the hormones, the deficiency. You can diagnose anorexia nervosa. No need to proceed for MRI unless you have headache and you suspect pituitary adenoma. Now the time to do the MRI, right? Okay, Dr. Huda?
Yes.
So
Yes.
amenorrhea, as Dr. Mahmoud said, it's rare scenario, but if it comes and you didn't do it once in your life, you'll be in trouble. But just calm down, even if you don't practice the complaint, any complaint, if you follow the approach, believe me, at least you can reach to the two differential, which is related to the case. With the same approach, I prefer. Try to train on this approach. Believe me, it will be very easy for you to catch any diagnosis. Okay, even you don't have the diagnosis, you will have three differential. One of them, it might be the case. Okay? Any question, Dr. Huda?
No, thank you very much, Doctor.
Okay, Dr. Mahmoud, you want to add any?
Thank you, Dr. Bassem. Thank you very much.
Okay. Now, Dr. Yes, your case, Dr. Mahmoud, 65 years, Mr. Ahmed came with cough. I
Yes,
will try to prepare yourself. I will try to read the comment quickly.
I am ready, Dr. Bassem.
Okay, I will finish the
Okay.
comment, then you can
Take your
start.
take your time,
Yes.
doctor.
Okay, mood change, perfect. Yes, I didn't mention the mood, the sleep. These are the symptoms which is not in the approach. So you have to remember it whenever you have a stress patient with stress. You have to ask about the mood change or sleep. In any patient you suspect something related to the stress. For example, irritable bowel syndrome, fibromyalgia, chronic fatigue syndrome, or tension headache. Okay, our case today, anorexia nervosa. Any patient with CNS manifestation, you have to ask about also mood change and even behavioral change. Some patients will present with behavioral change, particularly stroke or Parkinson or something central. Okay, don't forget. Induced vomiting, yes, thank you, doctor. Intention, weight loss or no, to roll out anorexia nervosa, exactly. Candidate keeps repeating some question. Yes, take care, Dr. Huda. Try not to repeat because it seemed to the examiner that you are not focusing with your questions. Body mass index normal 25 to 29, but it will be less than 20. I think maybe also less than 15, not 20. 20 maybe bulimia, but less than 15 anorexia nervosa. Correct me if I'm wrong. I think meant what is it value number for body mass index. Yes, you have to ask the patient body mass index or offer. I need to know the body mass index. Second, amenorrhea due to excessive exercise, pregnancy, exactly. Tough case if someone didn't, Dr. Marwa, encounter it before. As I said, exactly. Those who have heard about it will have advantage. Still, well done, Dr. Hodayes. What are the differential? We mentioned anorexia and pregnancy and bulimia nervosa. This is my differential. You can add to them also pituitary axis failure with stress and excessive exercise. Some females doing the same and they are losing the period. Difficult case, I agree. Could you explain why secondary hypothyroidism causing amenorrhea? Yes, if we have panhypopituitarism, so the patient will be hypothyroidism, hypo, I mean Addison, so low is ACTH, and the patient will have Addison, secondary, of course, Addison, and he will have also, or she will have, failure of the gonadotrophin, so the patient will be having amenorrhea. So all the axis from pituitary downward will be failed. And primary hyperthyroidism causing amenorrhea. Supposed to have oligomenorrhea, not amenorrhea, but some patients they will lose the period or they will have amenorrhea, but not commonly. So the commonly with primary hyperthyroidism, they have scanty period, which is oligomenorrhea. Basis wise, Dr. Marwa, postpartum thyroiditis, they bring it with amenorrhea, which I will be, which will be psychological related to postpartum period. The surrogate will say she had complicated delivery. The trick is to ask if she was able to lactate. This is to differentiate between Sheehan and postpartum thyroiditis. So in Sheehan syndrome, the female or the lady will not be able to lactate. In postpartum thyroiditis, she will be able to lactate. Yeah, it's common case postpartum thyroiditis, so you have to ask about pregnancy and the event after the pregnancy. Anything happen, and the symptoms and signs of hypo or hyperthyroidism will be positive. Dr. Nahla, osteoporosis if prolonged amenorrhea, calcium, vitamin D. Exactly, one of the complication. It would be also related to the malabsorption, or no malabsorption, it's malnutrition, not malabsorption. So the patient already not taking anything, she will also be deficient of all these vitamins. Thank you for the comments. Let's start. Dr. Mahmoud, ready?
Yes, Dr. Basim, I'm ready.
Yeah, here you go.
Okay, so what is the name? Mr. Ahmed. Okay.
Ahmed, yes.
Sorry, Doctor, I will not start. Okay. Good evening. I am Dr. Mahmoud, doctor in the clinic today. Let me confirm you are Mr. Ahmed, 65 years old.
Yes.
Mr. Ahmed, we are here to discuss about recent complaint and also to examine you. Is it okay with you?
Yes.
Okay, brought to my knowledge that you have a cough. So, could you tell me more about that, please?
Yes, doctor. I think now 10 days I have cough. Yes.
It is,
Yes.
Okay, it started suddenly or gradually?
Suddenly, doctor.
It is the first time you have cough or any previous attack?
No, I have previous same problem like this, cough with fever like this, doctor.
When was the last time?
Previous maybe before 2 months, same.
2 months?
And this is, yes, and this is the second time, same doctor, cough, and I have also fever.
So it is the same attack. Okay, how many times you have this attack before?
I think this is the second time, doctor, during 2 months.
Okay. Any specific time you have this cough? More at the morning?
No, doctor.
No specific time? Okay, how many time? Okay, do you notice that anything increase the cough, like any dust or perfume, or during exercise or during exertion?
No, doctor.
Okay, you try anything to relieve this cough, like any inhaler? Or,
I take cough syrup, but I feel I'm not improved.
Sorry for that, Mr. Ahmed. Okay, Mr. Ahmed, it is dry or have phlegm?
No, with a phlegm.
With a phlegm, okay. Do you have any? What is the color of the phlegm?
It's yellow, doctor.
It has odor or no odor in the phlegm?
No, I'm not observed really.
Okay. Does it contain any blood?
No.
Okay. Do you, Mr. Ahmed, do you have any nasal discharge?
What?
Nasal discharge.
No,
Discharge from the
doctor.
nose?
No, doctor.
Do you notice any crusting in the nose?
No, doctor.
Do you have any chest pain?
No, doctor, no.
Any noisy chest? Do you notice that your chest is noisy?
No. I feel I have pain when I cough only, but not no chest pain.
Okay. Do you have any shortness of breath?
No, doctor, no.
Any shortness of any difficulty of breathing when lying flat?
No, doctor.
Any difficulty of breathing awake you from the night, searching for the air?
No, doctor.
Do you notice that your leg is swelling?
What?
Leg is swelling, your limb?
No, doctor.
Okay, Mr. Ahmed, do you have any problem in the water work, like the amount or frequency, any change in the color?
No, doctor.
Okay, do you have any joint pain?
Yes, doctor, I have rheumatoid arthritis.
When it is diagnosed, you remember?
Now I think 12 years, yes.
Is this any joint swelling?
No, in my hand I have swelling and pain in the joint of my hand.
There is deformity in your hand?
Yes, doctor.
Can I ask you what is the medication you're on?
I use methotrexate and I use the painkiller. Yes, doctor.
It is controlled?
Really, I'm not use the medication well. I'm not follow all the time. I try to follow, but I have some issue for that. I'm not follow well with the doctor.
Okay, any recent change in the dose recently?
No, doctor.
Okay, do you have any back pain?
No, doctor.
Any rash in your body now or previous?
I don't have rash, but I have some blue discoloration in my skin, doctor.
How is it exactly? In your hand or your back or your tummy?
In leg, no, in leg, in my hand more.
Mhm,
And
mhm.
any small trauma, I have this bluish in my hand and leg.
Okay, Mr. Ahmed, do you have any other than rheumatoid arthritis? Do you have any increased body pressure, increased blood pressure,
Mm.
blood sugar?
No, no,
Uh,
doctor.
Do you have any previous infection?
Yes, I told you I have a previous infection before 2 months. Also, I have same cough with fever. Yes, doctor.
Do you have any previous diagnosis with tuberculosis?
No, doctor.
Okay, can I know what's your medication list other than methotrexate and the painkiller? Do you take any
Only
other?
doctor. No,
No,
doctor. I'm not
no.
taking any other. Yes.
Okay, do you have any family history of cancer or any gland
No,
disease?
no, doctor.
Okay, I will ask you, Mr. Ahmed, some general question. Do you have any raised body temperature?
Yes, doctor. I have fever. I started with the cough.
Mhm. Do you measure it?
Yes, 38.
How frequent per day this fever?
I feel all the time I have fever.
Do you try painkiller to decrease the fever?
I use paracetamol. I
Mhm,
improve little, but the cough with
mhm,
the phlegm not improve. For that I came.
mhm. Okay, do you have any tiredness? You feel tired?
Yes, with the when I have this cough and fever, I feel I am tired.
Any sweating, Mr. Ahmed?
No, I'm not
Any
obsessed.
night
Yes,
sweating? Night sweating?
no, no, doctor.
Anyone notice that you are paid than before?
Mm, and nobody comment for me, doctor.
Okay, any weight changes recently?
No, doctor.
Do you feel anytime dizziness? You feel dizzy?
No, I feel tired since this last 10 days.
Okay, do you have any
But
weakness in your body?
yes.
Okay,
What,
Mr.
doctor?
Ahmed. Do you have any weakness in your body?
No, no, doctor, no.
Any numbness?
No,
Do you have any headache or vision problem?
no, doctor.
Okay, Mr. Ahmed, do you have any mouth sores?
No, doctor.
Any heartburn?
Sometimes with my disease, I have dryness in my mouth.
Okay, do you have any heartburn? Do you feel
No,
heartburn? Any acid
no,
brush?
doctor. No, doctor.
Any change in your bowel, like loose motion or hard motion?
No, no, doctor. No.
What do you do for a living, Mr. Ahmed?
I am retired.
How much symptoms impact your daily activity?
Really bothering me, doctor. This is second time I have this problem
Mm,
for that. And 10 days now, fever with cough, not
mm,
improve. And I am tired. Sure
So,
bothering me, doctor.
sorry for that, Mr. Ahmed. I will try to diagnose you and give you suitable treatment. Do you
Okay,
smoke, Mr.
thank you.
Ahmed? Do you
No,
smoke?
doctor.
Do you
No,
drink
doctor.
Do you drink alcohol?
Yes, doctor, socially.
Socially, okay. Okay, Mr. Ahmed, do you have any pets or parrots at at the home?
No, doctor.
Okay, can I examine you, please?
Yes, doctor.
Okay, first I will examine the hand. First for
Yes.
any, yes, any clubbing, any
No clubbing. No
no,
clubbing.
no clubbing. There is any wasting in the hand
No, doctor. But there
Okay.
is deformity of the rheumatoid.
Of the rheumatoid. I will. Okay, there is deformity. Any deformity, swan neck or boutonniere.
Yeah. Yes, yes, doctor.
Swan neck and boutonniere. Yes.
Yes.
Okay. Then I will go. I will do. I will do. I will يعني palpate the joint for any tenderness, any effusion.
No, mild tenderness.
Okay, I will see if there is any the temperature also and the tendon for tendonitis, and I will.
No.
Okay, and I will
Yes.
do. Yes, I will do function, prayer sign, and I will try to give him coin to catch the coin.
There is difficulty in the function, not good.
Okay, then I will measure the pulse and also
Pulse,
any pulse,
yes,
yes,
pulse 90, doctor.
and the blood pressure and the temperature.
Temperature 38 and blood pressure 130/80.
Mhm. Sorry,
Yes,
temperature how much?
38.
38. Okay. Okay, then I will go up to proximal myopathy if there is any proximal myopathy.
Yes, there is proximal myopathy. Yes.
Okay, then there is proximal myopathy. Okay, then I will go to the eye to see if there is any pallor or jaundice.
Yes, there is pallor, no
There,
jaundice.
there is pallor, no jaundice. Okay, then I
Yes.
will go to the mouth to see if there is any central cyanosis.
No, doctor.
Okay, then I will go down to the chest from the back to see if
Yes.
there is any parallel chest or
No,
any wasting in the chest. I
no,
will,
doctor.
okay, I will do chest expansion first.
Normal.
Okay, okay, then I will do percussion.
Yes, there is dull percussion in the right middle zone of the right lung.
Right middle zone. Okay, then I will do auscultation
Yes.
from up. There is any coarse crepitation or any fine any coarse crepitation.
In the right lung, in the mid zone, there is bronchial breathing and there is crackles. Yes.
This crackles. Okay, I will ask Mr.
Yes.
Mr. Ahmed to cough if this crackle
Yes.
disappear.
No, doctor.
So it is coarse crackles. Yes,
Yes. With bronchial breathing.
with bronchial breathing, crackles and
Yes.
bronchial breathing. Okay, then I will go to the chest from front.
Yes.
Okay, to do also auscultation.
Yes.
There is the same right middle zone.
Same,
Sorry,
doctor.
the right lung, Doctor. The right lung.
Yes. Yes,
Okay,
doctor. Middle zone. Yes.
okay, then I will do the heart at the apex if there is any displaced apex.
Yes. No. Apex in the same position. No.
Okay, then B2.
Specific character.
Yes, I will
No.
palpate B2 if there is any cell.
No, doctor.
Okay, then I will the abdomen to see if there is splenomegaly.
Yes, there is a splenomegaly. Yes.
Okay, then I will see if the patient has any rash and also touch this rash. I think it is ecchymosis.
Yes, ecchymosis in the body. Yes, but no rash. Yes.
No rash. Okay.
Yes.
Then I will go down to see if there is any lower limb swelling.
No.
It is no. Okay, Mr. Ahmed, did you travel recently?
No, doctor.
Okay, I can ask you private question, but I ask it to all my children or my patient. Do you have any history of blood transfusion or sharing needle, tattoo,
No,
piercing?
doctor. No, doctor.
Sorry for this question. Do you have any casual unprotected relationship?
No, doctor. I have my wife.
Okay. Okay, Mr. Ahmed, can I know what's your concern, please?
Why, doctor? I have this chest pain. No, sorry, cough with fever.
I think, Mr. Ahmed, I have many I do understand your worries. I have many possibilities of your condition. Most probably, you have a condition called bronchiectasis.
2 minutes left.
Bronchiectasis. It is a condition. Sorry, Mr. Ahmed. Most probably, you have. Mr. Ahmed, do you try recently any other treatment other than methotrexate?
No, doctor. No.
Methotrexate only. Okay, Mr. Ahmed, most probably you have a condition called bronchiectasis. It is a condition which affects the lung, cause widening and thickening of the sacs of the lung. So what we are going to do now, we will admit you.
Yes.
Okay, and we will do some scans to your chest and do some blood tests, and I will update you. I will update you about the result.
Okay, doctor. Okay. You will not give me antibiotic and I go home, doctor?
No, I will admit you, Mr. Ahmed, and also give you take some investigation and do some scans, and I will give you a suitable antibiotic for your condition.
Okay, doctor. Okay.
Mhm.
It's serious?
I'm sorry to use that, Mr. Ahmed, it is serious if not treated well.
Okay, doctor. Thank you, doctor.
Okay, thank you, Mr. Ahmed.
Still 30 seconds. You want to ask any history questions or examine something particularly?
Examine course crepitation. No night sweating. No.
Yes, no.
You examined the spleen.
Yes.
Was it positive?
Yes, splenomegaly.
Okay. Time is up. 15 minutes now. You can start the question, Dr. Huda.
Okay, doctor. You can present your case, Dr. Mahmoud.
Okay. Today I examine Mr. Ahmed complaints of cough since 10 days. It is the second time. Last time was since 2 months. Mr. Ahmed has productive cough and also has past history of rheumatoid arthritis on methotrexate, but the disease not controlled. On examination of Mr. Ahmed has a rheumatoid hand in the form of swan neck and boutonniere, and also he has fever, 38 degree. On examination of the in the eye there is pallor, and also on examination of the chest there is bronchial breath sound in the middle zone of the right lung, as well as there is coarse crepitation. On examination of the abdomen, there is splenomegaly, and also there is widespread of ecchymosis along his body.
Yes. Okay, what's your diagnosis?
So my differential diagnosis, I have many differential diagnosis. First of for that, it may be bronchiectasis.
Yes.
Okay, and the second may patient also have pulmonary fibrosis due to the methotrexate or rheumatoid arthritis. Also,
Yes.
patient have splenomegaly, so most probably it is Felty syndrome.
Yes.
Associated with ecchymosis, and also patient. Also, I would to screen for TB because the patient has fever and recurrent infection, so I need to exclude the TB also. And in the bottom of my diagnosis may be cancer. Apart from that, patient wasn't smoking, and also there is no B symptoms like any loss of weight or loss of appetite.
Okay, doctor. Okay, how you will manage the patient?
Okay, first I will admit Mr. Ahmed because the patient has fever and recurrent infection. So I will admit I will do resuscitation to Mr. I will do resuscitation, and also I will do basic blood test like CBC, looking for any anemia, increased white blood cells, looking for any increased infection, and also inflammatory markers. And also I need to do EPG and the electrolytes. And according to the bronchiectasis, I will do X-ray and also CT chest, high resolution CT chest and pulmonary function test, and also sputum culture. And yes, I will do ultrasound to the abdomen to confirm splenomegaly. And
okay.
Anything other thing? Yes, I will do.
Okay,
I will do X-ray to the chest, to the other. So sorry, X-ray to the hand. That.
Okay. Yes, doctor. Okay. Thank you. I finish my question.
Okay, I will ask him other questions, Dr. Huda.
Yes.
Dr. Mahmoud, you mentioned the image, right? What image you will start with?
Yes, I will do X-ray first.
Okay.
And also high resolution CT. CT looking for signs of bronchiectasis, like a signet ring in the CT, and also X-ray for hyperinflation.
Okay.
Mhm.
What other invasive test you want to do here?
Yes, I patient we need bronchoscope, biopsy,
Okay. To do biopsy only or?
uh, to aspirate,
Yes.
to
Yes, bronchoalveolar lavage, right?
bronchial lavage. Yes.
You
Yes,
suspect infection.
yes. I also forget to TB investigation.
Exactly. So acid fast bacilli you will do?
Acephalus bacilli, Nelson stain, and also if the and also PCR in the blood.
Why you mentioned this?
TB.
Okay. What if this patient presented with dry cough? What other
Broncho,
difference?
yes, bronchoalveolar lavage.
Yeah, what if the patient presented with dry cough? Do you change the diagnosis?
Yes, maybe due to the disease of rheumatoid arthritis itself or the methotrexate.
Or
Uh, Methotrexate or the disease or
okay, if this patient is just walking for some or few steps and he will have dyspnea,
Mhm.
would you change the diagnosis?
Maybe you mean Dr. Basim heart failure?
A few steps with any exercise, the patient is having hypoxia.
Yes, yes,
Sort of that.
develop that with HIV, what's the pneumocystis carnii.
Yeah, so it's not only HIV, any
Yes,
immunocompromised, right?
yes, Dr. Basim.
And this patient considered as immunosuppressed or immunocompromised.
Yes,
So,
immunosuppressed. So I should exclude, yes,
okay,
pneumocystis
what
carnii.
stain you will use for BCB?
I forget really, Dr. Basim. طيب, I forget.
James
Uh,
stain or
James,
silver?
yes, silver.
Yes, silver stain.
Yes, doctor.
Okay, that's enough. 6 minutes. Dr. Huda, you can comment now.
Okay, he take the history well. Okay, and he examined the patient also. The history, Dr. Mahmoud, short, only 10 days cough and fever. And by examination, there is bronchial breathing. It's go with the pneumonia, okay?
Yes.
The patient, he has recurrent infection. And by examination, the patient, he has ecchymosis, Baylor, and he has recurrent infection. That's meaning there is agranulocytosis, okay? He has bone marrow suppression, okay?
Yes.
Recurrent infection mean neutropenia and the patient rheumatoid arthritis. And by examination, there is a splenomegaly. The diagnosis of this patient, Dr. Mahmoud, Felty syndrome. I agree with you. You're thinking about another infection like TB, HIV, and like that. But in this case, he has Felty syndrome, doctor. Felty syndrome came with the rheumatoid arthritis of long standing, more than 10 years. Okay. It's more common in the female, but earlier in the male. Okay.
So it is a case of pneumonia, normal pneumonia due to neutropenia.
Pneumonia, but the hint, the patient, he has recurrent pneumonia. Most infection in the Felty syndrome, they have skin and pulmonary infection. The hint, the patient, he has recurrent infection now. Okay.
Yes.
And this patient, most organism encapsulated and staphylococcus, streptococcus. Okay. And this patient, he need admitted and dealing with like febrile neutropenia. Okay. And this patient need first to treat the rheumatoid, need to control the disease first, and we can use the hemobiotic stimulating factor. If the Felty syndrome resistant, we can do for them splenectomy, doctor.
Yes.
Okay. But I agree with you. You think about TB, yes, and for any another infection, yes, because he is immunocompromised. But splenomegaly with the recurrent infection, and also another blood cell low, like because this patient anemic, and he has ecchymosis because thrombocytopenia also. Okay, and another diagnosis, you can think about the methotrexate toxicity. It cause also same problem. It can cause low platelet and hemoglobin and WBC. Okay, but
Yes.
but you asked me about the patient, if he, what about the dose and medication? And this patient, he must use folic acid with the methotrexate also. This
Yes.
patient not use. Okay, this is how you will honor it.
Mhm.
Thank you, doctor. But you did well, really.
Thanks, Dr. Hoda. Thanks. Nice case.
Okay, thank you, Dr. Huda. But I disagree about the performance today. Dr. Mahmoud was too much disorganized. Are you agree, Dr. Mahmoud? What do you think?
I start with analysis
Exactly.
and
Yeah.
then the chest and then the renal and also rheumatology.
Yeah, you ask, you start the systemic review after the relevant system. Then you ask about constitutional. Then you ask back the system review in a headache.
But in package Dr. Basim يعني.
Okay, you like the bundle wise?
No,
Anyway.
no, doctor. No, I start with chest and
No,
then
no, but you ask about the GI, then you ask about the constitutional, then you ask about the CNS. So
yes.
it seemed like you are disorganized. This is my impression.
Mm,
I don't know if anyone also agree with this, but for
Just
me,
he is just nervous today. I noticed that
right?
no.
he's
Is it Dr. Aisha?
like having exam today. Yes.
Dr. Aisha, honestly, did he do in organized way? What do you think? Because he even, I think he didn't reach
I think
diagnosis.
he not focusing good today.
Yes,
Yes, and he sound like worried or even
stressed.
in the tone and and the tone of questions, like hurry up questions. And
Exactly.
yes, he don't focus about the main complaint and go towards it. Yes,
Mm,
I think he making like, I don't know, but I felt that
This is what I
so
felt as well.
yes,
Yeah, this is what I felt.
but
Really.
not that disorganized. Just he is like nervous or like someone who's when he is nervous or worried something. So I think it's not the usual of Dr. Mahmoud. Yes.
Exactly. This is what I want to
very,
say. This is not
very,
Dr. Mahmoud
pre-exam
performance.
syndrome. Mm.
Yeah, this is not your performance, really. So please try to collect your thoughts again, follow your approach, whatever you are in favor to follow. I'm not pushing you
And the
to
past
lose mine.
history
Yeah,
very early, Dr. Mahmoud. We are accepting the past history very early. Uh,
Mm,
exactly.
Specifically with something you still not from the analysis you reach the diagnosis, give the past history first.
Mm,
It will lead to you easy to catch the diagnosis after that. And after that, no problem to do systemic review. But I think first finish all the, because rheumatoid have a lot already of things you
exactly.
should ask. Yeah.
so I put past history to Aisha in the first or
Late.
First, you bring it very late. I think after
Yes,
5 minutes you ask,
late. Yes,
and it is
mm,
about joint pain, and she tell you I have rheumatoid at that time.
yes,
But you should, after analysis, directly, if you didn't reach from the analysis to guide you a system, ask directly the past history and the constitutional symptoms. It will guide you. Also, the constitutional symptoms, you ask it very late, the fever and its cough.
yes.
How you will
yes.
not, it should be first. And if
Mm,
you did both items early, it will be more
You will be
relaxed
lost.
for you, and you
Exactly.
will be more relaxed. So if you
Yes,
didn't
you.
reach from analysis only, Dr. Mahmoud, ask
mhm.
past and constitutional symptoms first
This is
before
what I
any
prepared.
systematic. Yes, before
Yes,
any systematic review, because it will give you a relax. Even any the past history and constitutional symptoms, it must have a clue in your
exactly.
case.
Yes, this is what I felt, Dr. Mahmoud, and I think this is not your habit to go randomly as a questions. Anyway, still you are learning and try to. The previous time was perfect. Really, when I said you, Dr. Mahmoud, today was perfect. Really, you were perfect. But today, I think you're lost in between. I think also you didn't catch the diagnosis.
Yes, I
until
didn't catch
she-
till the
Exactly.
end.
Till the end when she mentioned there is splenomegaly. Why? Because you didn't ask about the system review in good way. Okay, you analyze, yes, the relevant system well, but you ask question from here and there. You finish the constitution, then you ask again about the headache. I don't prefer to do this approach. Really, whenever you start something, finish it, but please start the constitutional after the relevant system. Here, the chest is the relevant system, right? Finished.
Mm.
After finishing the relevant system, which is the chest, short of breath, noisy breathing, nasal discharge, all this question accepted, okay, you can do. But after that, ask about the constitution. Any loss of weight, any loss of appetite, definitely this patient might have loss of appetite because of infection, okay? Yes, he might have fever, night sweat, maybe as infection. Then ask about contact with sick patient, any pallor, someone told you are pale than before, you have any dizziness, as a question for still constitutional. You want to add here travel as history of some community acquired pneumonia, you can ask. If you don't, it's okay. Postpone this question to the travel later on, but ask about the past medical condition. Any past medical history I should be aware of. She will give you rheumatoid. Even you didn't analyze the methotrexate compliance, right? Did you ask when was the last time when you started the methotrexate? Did you?
No, I think no, Dr. Bassem.
Yes. Even
Mm.
the medication, which is folic acid, you should take weekly.
Mm.
You didn't ask about to rule out
Yes.
methotrexate toxicity. So please focus. Try to finish the constitutional and past medical history before systemic review. Even you want to go through the systemic, I agree to go, but not early. If you go through them early, you will be lost in between the symptoms and findings. But if you have a clue, then you can confirm your clue. Okay, I have a clue now of fever. This is a clue for pneumonia. So I will confirm the pneumonia later on by travel history to rule out, or even here you can ask about brucellosis. You didn't ask about contact with raw milk or drinking raw milk because brucellosis can present with chest, back pain. You ask about the musculoskeletal, but you didn't have a clue or a clear diagnosis till the end. Fever
Mhm.
with pneumonia and tummy discomfort. Did you ask about tummy discomfort? If you ask, she will give you splenomegaly as a tummy discomfort or a tummy fullness. I think you didn't ask it. You ask about any change of the bowel habit.
Ask about only yes, acid brush and heartburn and constipation.
That's it. The most easy and initial question for abdominal or GI, any tummy pain or tummy discomfort.
Discomfort.
Yeah, discomfort here for fullness or for splenomegaly, she might tell you, yes, doctor, I feel some fullness in my tummy. And you can have Felty syndrome from the case. The joint pain, the stiffness, you didn't ask even how long the stiffness in the morning, right?
Yes, I didn't.
Okay, forget about it. At the end, you catch the diagnosis, but you have to be ready with a differential. What are the differential here? What is the most common pneumonia? You didn't say pneumonia, by the way, right?
No, no, no.
Okay, well, you have consolidation, bronchial breathing. This is pneumonia or consolidation. What are the most common infection in any case, particularly
Uh,
the immunocompromised?
the staph
Why you said staph?
or Haemophilus influenza, Dr. Bassem.
No, the hemophilus for the COPD patients.
Mhm.
Common is common.
Common يبقى what
It's common in the not in the immunocompromised. I am talking about consolidation, lobar pneumonia.
strep
Streptococcus.
strep
Exactly.
strep.
Streptococcus. This is the most common. You didn't mention. It's the most common on the whole population. Imagine with the immunocompromised the same prevalence. So still streptococcus as lobar pneumonia. You didn't mention it at all,
Yes.
right? So streptococcal on the top. You can add whatever you want after that. But streptococcal with lobar pneumonia you have to mention. Okay.
Mhm.
Then you can say the other pneumonias as immunocompromised TB, but again, is that because no dry and there is yellow yellow sputum or phlegm. Okay, that if there is blood, you can add TB, right? Or you can put BCB, but again, it's BCB patient is not having hypoxia while walking or any exercise. But the main diagnosis here will be Felty syndrome based on the neutropenia, recurrent infection, rheumatoid, and the splenomegaly. If there is dry cough, you can say BCB on the top, or you can mention methotrexate side effect. You can say fibrosis, interstitial lung disease as well. But here you cannot say both of them because it's wet cough, right?
Yes, Dr. Bess.
Anyway, just calm down, relax, as Dr. Aisha said. And please, even if you have difficult case, please, if you follow the approach, really, you will catch any diagnosis. But if
Yes.
you start to ask question from here and there, system review and back to the constitutional, then the complaint, then if you are looking, even if you catch the diagnosis, they will minus you. Believe me, they will minus you for the unsystematic approach. So okay, so even you know the case or diagnosis, without approaching well, you might minus or you might lose the skill of clinical communication. Plus examination. I don't know. Here they can give you the examination because you examine the abdomen, you examine the chest, the joint, look, feel, and move. Yes, you did all of them.
Yes, in the feedback, Dr. Basim, the last
Yeah.
exam,
Yeah.
in the case of sarcoidosis,
Okay.
he write already in the communication skills
Systematic.
yes, unsystematic.
See?
He write in the feedback, yes.
Yes, I know this feedback. Because whenever you ask in unsystematic way, they don't like at all. Follow the approach. I prefer.
Yes, and I think it is the same case. The case was cough, also dry cough.
See, because you are lost. You are asking. You are trying to catch the diagnosis without
And I
systematic
think
question.
I do the same like today. I ask
Exactly.
about the cyst and renal and
That's
rheumatology.
why I didn't comment positively today. I
Yes,
commented negatively intentionally because you are not. This is not your habit. You are not Dr. Mahmoud who's doing it in perfect way. Please, if you want to revise, you can do it again. Analyze of the cough. Is it cough or yes, cough? The type of cough, the amount, if there is expectoration, so you can ask about the color, the odor, all this good. The relevant system here, the chest, any coughing up blood, any noisy breathing, nasal discharge. That's it. Any leg swelling if you want to add anything increase or worse it, exercise for example, lying flat. Finish these questions for the relevant and the complaint.
General.
Jump or no, not the constitutional.
Constitution.
Now yes, any loss of weight, night sweat. Now you are removing or excluding TB or putting TB as a differential. Any night sweat or fever, any pneumonia will have fever. Particularly with the night sweat, you will add TB to your differential. Any loss of appetite, loss of weight, this is related to either serious infection, HIV and other infection related, or you can think about cancer even. Okay, finish the constitutional. You can add some constitutional like dizziness from standing to sitting, or from sitting to standing. You can consider it as one of them. And lumps or bumps is very important here. Any lumps or bumps for cancer or HIV. The next thing will be for past medical history. Now the clue will be clear and ready. Yes, I have rheumatoid. Analyze the rheumatoid. Since when? What are your medication? Did you add? Are you compliant? When was the last dose of methotrexate? Okay. Do you have any recurrent or previous infection? Yes, I have. Or past medical history, past surgical history, any allergy to any medication, any hospital admission. All this will help you in over-count medication. You finish this, believe me, at least you have two differential. If you finish the constitutional along with the past medical history and all surgical history and the hospital history admission, you will have at least two differential. let's imagine either here in this scenario, pneumonia, fever, patient is febrile for only 6 days, right? So it's something acute or subacute. Pneumonia on the top of my differential. Still, I don't know the type of pneumonia, so I can later on pick up if there is travel history. I can think about chlamydia, for example, right? If there is history of travel recently, or Legionella, if he traveled recently, right? Because he's immunocompromised, or even if he's not immunocompromised, he catch the infection from the community, either Legionella or chlamydia. According to if there is AC history of travel history in the hotel, AC or air conditioner related, so you can think about chlamydia. If not, you can think about Legionella. And if something else, you can think about endemic traveler or some condition related to endemic area like histoplasmosis or whatever. It's not common, but I mean, just think about the travel related. But this will be after the system review. Why will ask the system review? To catch any other association. Here I can add, if he has chest pain, for example, I can think about ischemic heart disease. If he has tummy fullness, as in this condition, I will think about splenomegaly and Felty syndrome. Okay, musculoskeletal joint pain, skin rash. Just to think about other association with rheumatoid. You might have mixed connective tissue disease, and you will be unlucky not to pick up any of these other association of or mixed connective tissue disease. Okay. Then the travel, HIV history or questions, family history, and do you use question smoking here? You can put cancer if he's heavy smoker for long term. And the alcohol, I think it's not related here or irrelevant. The job, what do you think if the job here, does it make sense if you ask about the job?
Yes, he retired. But about the job, maybe مثلا
Previous, yes, previous job. Always
job,
whenever
yes,
retired with
yes,
chest, ask
yes.
about previous. Why previous? It might be related.
Yes, maybe asbestos or silicosis.
Exactly.
Yes,
Coal
okay.
worker.
Coal worker.
Any of these can be related. So occupational pneumoconiosis will be as a general term. And whatever the exposure, you can add to your differential. It might be the
Yes.
case, by the way, from the job only. So maybe at the end of your history, the job, what's your job? I'm retired. What's the previous job? You can add a differential, or you can conclude the case or the diagnosis from the job only, and he's retired. Okay?
Okay, Dr.
So
Bassem.
just be
I-
systematic. Even if you will not reach, they will give you good mark for the approach. The examination, of course, you did it well because you have 3 systems here you have to examine. The hand, the rheumatoid arthritis, the chest as a complaint, and abdomen to occasionally you might have the splenomegaly. Okay, but at least you will examine for the hand and the chest. Chest full examination, by the way, from inspection till the auscultation. Inspection, palpation, percussion, auscultation. The back and the front axillary lymph node. Don't forget the axillary lymph node and the cervical. Very important here. You can't say this is the third system you have to examine, the lymph node.
Yes.
Okay. Yes, I think. Sorry, Dr. Mahmoud,
Yes.
for my comment today, but you have to.
No, take your time, Dr. Bassem.
Okay. Yeah,
You know.
I want you to be as usual, Dr.
Yes,
Mahmoud. Okay.
I will back to my
Yeah,
approach.
try it.
Okay.
To do it. Okay. Thank you, Dr. Mahmoud.
Thank you, Dr. Bassem. Thank you, Dr. Aisha. Thank you, Dr. Huda. Thank you.
Okay.
Thank you.
Yes. Anyone with question? Dr. Huda, you want to ask?
It's no problem, Dr. Mahmoud. We all doing like that from time to time.
Yes.
إن
Thank you.
شاء الله في الامتحان بقى أهم حاجة إن شاء الله.
إن شاء الله.
Yes. To be perfect in the exam. This is our aim. Okay.
Dr. Bassem, please,
Yes.
I have one comment.
Sure.
Because my last exam, I think one case similar to this case of Dr. Mahmoud. And I have one comment regarding putting TB and HIV in the differential diagnosis because they put both of them in my feedback.
As
That I
negative
said,
feedback, as negative comments.
yeah, I have to put them in the differential.
Although
Exactly, yes.
I asked in the history about all history regarding TB, regarding fever, night sweating, contact with sick patient to
Yes.
exclude the TB. And the other thing regarding HIV, all the history was negative. Yeah, no,
But
no,
you didn't
no.
mention them in the examiner questions.
Yes.
Yes,
Okay.
the same, doctor, the same.
Although there was more logic diagnosis. You got me, and the case was
Always,
carbimazole induced neutropenia.
yes,
So
the
I
same,
thought,
immunocompromised, yes.
yes, I thought that if the history is negative, I should not tell because there is more logic diagnosis. But unfortunately, they minus me in the differential diagnosis because I didn't put them. Although I put first carbimazole induced neutropenia and also maybe associated. He told me what if you thought that Graves autoimmune condition, what you should think of. I thought of hypogammaglobulinemia, and he asked me how to manage to give immunoglobulin, and also the others that the patient was diabetic, so also he is immunosuppressed, more
Yeah, this
liable
is
to
the
get
point.
infection because the case was pneumonia, also recurrent pneumonia. Then I thought about I think I asked the surrogate about any history of TB or history of HIV risk. No history, negative. So I didn't put them in differential diagnosis. They minus me. This is only my note because you told Dr. Mahmoud that the diagnosis here will be Felty syndrome. No, sometimes they better to put them even if they are negative histories. This is what I think.
Yes, I agree with you. And we mentioned TB and we said against that no blood in cough. So you can or you have to put the serious differential with your differential, even if not in the top, but you have to put them in your
Oh,
list.
yes.
Yes.
I
So
should
put
put
it,
them.
yes, put the serious one as differential, not as a top differential, but at least put them in your differential. And you can say against that I don't have blood in the sputum, for example, or I don't have
Yes,
night sweats.
contact with sick patient, no
No
night
contact
sweating.
with the, yeah,
Yes.
exactly.
And
So
I
you can
think
mention
the
them.
Dr. Bassem, they were not caring about the final diagnosis. In my exam, the case that I reached diagnosis, I lost a lot of marks in it. And the other case that I give just a differential, I got a high mark in. So just it is not a matter that you reach or not reach diagnosis, just to be systematic
Even
and reveal all the
even
finding in your patient. Yes,
even yes, Dr. Raish, in this case exactly, because I reached the diagnosis. Even my colleagues, they didn't reach the diagnosis that carbimazole
and they
induced
Carbimazole
deduct you.
neutropenia.
induced.
Yes.
Then they wrote, even they wrote for me in the feedback that she only reached the diagnosis, and the other doctor,
They,
the
this
other
Egypt
examiner.
also, or what?
Yes, in Alex Center,
Yes.
and the
Okay.
other examiner, the other
This
examiner,
sentence will not come for
the other
Egypt
examiner,
only. Yeah.
the other examiner, she told, she mentioned the diagnosis, but she didn't stress in the diagnosis. One of them only reached the diagnosis. One of them
Stress.
she didn't stress in the diagnosis. I don't know.
Okay,
I
that's why
think
I'm saying,
I
yes,
think
continue.
yes, I think that's the same examiner. My case also was my case was Crohn's disease. The examiner in the exam tell me what else, what else.
Yeah, TB
He
again.
need TB also. He need the
TB and
TB.
tribe. Yes.
So the patient any Crohn's, mouth sores and blood diarrhea and recurrent
They
attack.
like to differentiate even
Yes,
any Crohn's infections. Even if you said only infection
yes.
causes,
I
because
tell
any bloody diarrhea, but
I
you
tell
didn't
him
mention TB,
yes, he need TB by name.
eh,
TB. He
because you
needs
are
that
in
word.
Egypt.
Yes. I think this is the same examiner. Mm.
That's why
Thank.
always put in your differential something serious you have to roll. Even if you roll it out, mention it in I should do to roll out during the investigation, for example. So I would like to roll out TB. Don't do unnecessary image unless you have some clues. But you can say to the examiner, I would like to rule out TB and HIV since he's having these symptoms or B symptoms or whatever. They like to mention the serious thing or the serious differential. Whatever the differential is, try to do that. Don't be calm while giving just light differential. Don't give light differential. They need to put something serious in your differential and roll it out by your history. Okay, let's imagine for the ischemic, the chest pain, typical chest pain, and you will mention everything without mentioning, for example, ischemic heart disease in a smoker patient. They will minus you even if they can fail you. Why? Because he's having risk factor for ischemic heart disease or coronary heart disease. Although the patient is not coronary heart disease patient, he's having sinusitis or pericarditis. But because he is smoker, you want to roll out, or they want you to roll out the most serious, which is ischemic heart disease or acute coronary syndrome or whatever. You got my point. So try to show the examiner that you are thinking about serious differential, and I should roll it out by history questions and during the investigation. Anyway, hopefully we have a good case or a good examiner which can understand. This is what we can wish for all of you, because sometimes the examiner will detect and will either guide you to the pass, or he will guide you to, sorry for this, for the fail. Okay, just be hopefully thinking, don't think about the negative. Dr. Mahmoud particularly, don't think about Alexandria by this feedback. Be or do your best and wish you the best.
Just for fun, Dr. Basim, inshallah.
Really, yes.
Inshallah.
Just calm down and do your job as a candidate with a calm and very polite way.
Mhm.
Okay.
Thank you, Dr. Basim. Thank you very much.
Okay. Occupational asthma, Dr. Nahla, I will read the comment quickly. Occupational asthma, yes, if there is noisy breathing. Of course, I will mention occupational asthma. But it will also be associated with dry cough. By the way, if you have dry cough, asthma is on the top of your differential. You have to put it in your, or COPD, according to the patient age. Okay, so dry cough means there is airway narrowing or obstruction. Not only that, I mean, it could be. So acid bash also can be the case, by the way, or GERD. So a wide differential, we can do it another day as a case, but it will not be our case date. Our case about productive cough. So it will not be asthma as a differential. Okay. Anyone with question? Yeah, full Dr. iPhone full name of the silver stain, BCB GMS stain for both cyst and trophocyte other than other stains. Yes, silver stain is enough. No need to mention all this name. Bronchoalveolar lavage, neutropenic sepsis should be excluded. If you have, Dr. Sarah mentioned, TB contact, yes, you have to rule out. Neutropenic sepsis, if you have hypotension, you have to mention the word neutropenic sepsis. But of course, you will have in the vitals hypotension or borderline blood pressure with tachycardia, along with fever, of course. Okay. Anyone want to comment?
Thank you all. Thank you, Dr. Basim. Only I mentioned this occupational asthma when you ask about the job, that jobs are important.
Yeah. Okay.
Thank you.
So, yeah,
Yeah.
thank you, Dr. Nahla. You have occupational asthma and occupational pneumoconiosis. Okay, by the way,
Yes.
there is two occupational. What the difference, Dr. Nahla? I will ask you this question now. What the difference between occupational asthma and occupational pneumoconiosis? Give me one differential with differential which is golden differential or golden difference between both. Occupational asthma, occupational pneumoconiosis.
The occupational asthma, it will be an attacks. The attack it will relieve at the end of the day, the weekend, like that, after coming back from work, like that. So it will be a hint. This is only occupational asthma that trigger only at work site. I think
Okay.
that
No, this is
need.
from the history. You know, this is
Yeah,
not
from history.
what I need, but it's as a history. You are talking about history taking. Occupational
Yeah.
asthma will be during the day, working days, and when he's at weekend, he will not have the symptoms. Okay, this is good difference. By the way, occupational pneumoconiosis, it will not be it's of one exposure, so it will be long time exposure. So this is not the difference I need. There is another difference, and it's very major one. It's vital difference between both of them. The category of even the disease itself, it will be different. The occupational asthma is, and the occupational pneumoconiosis is. Do you know? Anyone knows what the difference between? Sorry?
Extrinsic.
No.
I
I'm
don't
talking
know.
about a major term, asthma and occupational, or asthma or occupational asthma and occupational pneumoconiosis. What is
You
the
mean
main?
obstructive and restrictive like that?
Yes, that's it.
Yeah.
Yes, it's the major difference. Asthma is a restrictive one. Pneumoconiosis or the occupational, whatever the disease, it's restrictive. That's it.
Yes.
Okay.
Okay. Also, again, if you let me, I want to comment
Sure.
that sometimes in cases in exam, as I hear from many, as a presenting complaint, it may be not related to the background of the patient, like in this. So we have to be open mind in our differential, and so to stick to the approach in analyzing the complaint. So, like in these cases, Dr. Mahmoud, I think you are thinking about drug-induced lung fibrosis like that, or
Yes.
bronchiectasis. Yeah, but we have, if we stick to approach, we will start from the common one. So as it is productive, I will put infection in our differential like that. So not always as a presenting complaint it will be related to the background of the patient, as you said,
Exactly.
Dr. Bansi.
Yes, exactly. And always don't put in your mind a differential and try to make the case related to your mind differential. Okay, some doctors, they are trying to make the case as he's thinking, and he will roam all over the history to make the case as he's thinking. For example, if you suspect this is drug-induced methotrexate, you are trying to do everything to make the case as drug-induced. You don't have dry cough? No, I don't have. Is it dry cough? And you are again asking about the drug history, methotrexate for how long? Okay, but this is not dry cough. So roll it out. But try to know the history as relevant or related to the symptom. So yes, there is history of methotrexate. What I could pick up from the history or medication history, this patient might be immunocompromised because of the methotrexate, but it will not be related to the methotrexate as a differential, because no dry cough in this case at all. Okay. Thank you, Dr. Nahla, for your comment. Anyone would comment before ending the session? It's a lengthy today, almost 2 hours session. Anyone with question? I hope all get a lot of benefit today. At least we did the amenorrhea. And we
Yes,
did another complicated one. Yes, now you have the approach of amenorrhea, Dr. Al-Huda. You will not forget it again.
sure.
Yeah, and you have a good
Yes, again.
differential for amenorrhea. By the way, we talked today about the secondary amenorrhea. By the way, there is another type of the amenorrhea which is primary amenorrhea, and we can do it another day. I mean, primary amenorrhea would be different because the girl will not have the period at all, and you will have a case of a young girl or female which is not presenting before with any period, and the cause will be, or the differential will be totally different. Okay, be careful. If you have secondary, the differential will be our case today. If you have primary, I hope someone will prepare it on another day. The case will be different, totally different. Okay, we can do it in another day. Any question before ending the session?
Thank you, Doctor.
Okay, thank you also, Dr. Mahmoud and Dr. Huda. Thank you, Dr. Aisha, for your comment. Yeah, very good cases today, really. And we always learn and refreshing the minds with these cases. Although it's rare, but it can be memorizable one whenever we practice them once only. Okay, thank you everyone for the attendance. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.